I lost my son tragically, my firstborn, and that was the beginning of my therapy journey. And even though the people who killed my son, 1 out of 3 of them were incarcerated for it, it just still wasn't enough. It still wasn't enough to console me or members of my family. And so a psychologist recommended that I go into outpatient intensive treatment. And I thought, why am I gonna do that? You know, I work in substance abuse with the County of Los Angeles, and I knew about patients doing intensive outpatient therapy, you know, because I audit those programs. But I didn't think that that part of the program was for me. I have to say that that was the best thing I ever did, because even after losing my son tragically some years ago, it had been quite recent in my life that I lost 5 family members to murder. And then right after that, I lost my mother, and then her brother, and then my brother-in-law. So I wasn't handling my death and grief and dying stuff like I think a lot of people. You know, you grieve and you keep on moving, but I couldn't get the keep on moving part together. So I called Overland as one of the options that was given to me by a case manager one day. They were so understanding, and they were so kind, and they were so patient, and they got me into the program, and I live a long ways away from Overland. They said, oh, you can do it virtually. And I'm thinking like, okay, let's try that.
Hi, my name is Janet. I'm a breast cancer survivor. Obviously, that's a very traumatic experience. During this journey of breast cancer and the treatment, I experienced a lot of trauma, a lot of depression, and a lot of grief. So I recognized that I needed help, and I was in a really bad mental place. I wasn't functional. I wasn't who I used to be. When I came to Overland, I was very confused. I was in a really bad mental place, and I didn't know what to expect. I was a little bit skeptical about how I could be helped. By coming here and doing their classes, doing their teachings, being in a group setting, which helped me a lot because you get to meet other people, relate to other people, hear other people's stories, and combine those experiences and develop skills. The teaching started to click. The therapists were very patient because in my personal experience, I had to do a lot of CBT and had to retrain a lot of my thoughts and change the way I was viewing things in my trauma. The therapists were really good at that, and seeing other people share those similar experiences that I was going through, it helped reinforce where I was at. I didn't feel too different. I felt heard, I felt supported, and I felt that other people were in the same place that I was mentally and emotionally. I enjoy a lot of the classes in Overland. The ones that I enjoyed the most were the ones that were related to grief, related to PTSD, trauma, CBT, and DBT. It gave me tools and skills to process what I was going through. Individual therapies as well helped. I personally found more growth in the group support just because you just get to relate with other people and hear their experience and learn from them, and they learn from you, and that's healing.
The alumni program is great too, because I feel like that's the commitment of me giving back to what was given to me. It's been a great experience, and I'm still growing from it, and it's good to know that even at whatever age you are, I'm 63, but I don't feel like my growth has ended. I feel like a whole new beginning, and every seed is perfect in its own state of growth. You know, you can plant 3 seeds. You can give them all sun, you can give them all water, same air, same soil, but one may pop up faster than another, and one may not pop up at all for a while, but they're all perfect wherever they are. So I feel like that where I am right now is just perfect for me.
If someone you know, a family, a friend, is struggling with anxiety, depression, trauma, grief, all of that, I recommend this place. It's a safe environment. You can share your experience. It's a very healing environment. You meet people like you that are going through similar experiences, that are processing and feeling the same things that you are.